Would you take your seats, please? We'd like to begin the afternoon session. Well, welcome back. I hope everyone enjoyed their lunch and their good time of fellowship with colleagues. This afternoon session, as you know, is entitled Aging, Cognition, and Frailty. And I should just mention parenthetically before making comments about the session that will begin, that much of this is webcast. It's not much, all of it is webcast, and it's available to you. We certainly hope that the symposium today is not only a wonderful dialogue and education, but it will actually catalyze a national agenda and move this topic of aging in a much more significant way, based on the gaps that we would have identified here in today's discussion. This session will be moderated by Dr. Eric Larson, who is a Vice President for Research at Group Health in Seattle and the Executive Director and Senior Investigator at Group Health Research Institute. As we have done in the prior session, the moderator, Dr. Larson, will introduce the panelists, and then he himself will provide a brief overview of the advances in our understanding of aging, frailty, and cognition. The panelists will cover frailty as a clinical syndrome, the aging brain, and the challenges and the opportunities in Alzheimer's disease research and Alzheimer's treatment. Dr. Larson, please proceed.
Thank you, Al. It's a pleasure to be here, and I'm particularly grateful for the panelists that will be working together for this part of our scientific sessions. To my immediate left is Linda Freed, who's the Dean and Professor at Columbia in School of Public Health primarily, but also in medicine and epidemiology. My colleague Tom Montine, a neuropathologist and Chief of Pathology at the University of Washington. Christine Yaffe from the University of California, San Francisco. I think Linda and Christine have the record number of titles behind their names. And Tom McCaskey from Baylor, who you heard earlier ask a very perceptive question, and I'm sure you'll hear perceptive remarks from him. Our topic today is, I think, an interesting one. Obviously, I look around the room and we've made a lot of jokes about aging, but I think one of the seminal ideas that will come across today is a quote from Abraham Lincoln. I just realized this was Abraham Lincoln a week ago. He said, "In the end, it's not the years in your life that count, it's the life in your years." And I'm sure you all saw his picture as you walked into this building, because it was under his administration that the National Academies were formed. So today, talking about an aging society, I think 150 years later, that remark can stand the test of time. Well, why is that? As you heard from Laura, and that opening remarks that she gave us were fabulous, and I think you'll hear some themes from those as our panel goes forward. We're an aging society, and one of the things that an aging society does is experiences the conditions we're going to talk about, frailty and dementia. They become more prominent as we become more aged as an aging society, and we're not arriving at an aging society, we're actually becoming more of one, as she said. I use the age of 90 as the benchmark for the topics that we're discussing today. In 1980, there were 720,000 Americans over the age of 90. In 2010, there were almost 3 times as many, 1.9 million people over 90. And many of them are parents of boomers who at the same time are entering Medicare eligibility ages. By 2050, we will have more than 4 times as many people over the age of 90 as we have today. And the question that we hear in policy circles especially is, how are we going to care for so many old people? From the NIA and the Census Bureau, we know that 2/3 of people over the age of 90 have trouble walking or doing errands, such as going to the grocery store or doctor's appointments. Nearly half have trouble with bathing or dressing, and 4 of 10, and probably even more than that, have significant cognitive difficulties. So as a panel and as an academy and as a society, we can wring our hands and say, what can we do? But I think we can do a lot in the area of science and discovery and demonstration, and especially implementation of what we know so that people can have more life in their years. In introducing this topic, I'd like to just emphasize how far we've come since I was a medical student and a resident. I used to think about aging as nothing but an inevitability of processes that as Laura showed, this downward curve. And I think that time has gone. A couple of things that I think you'll hear from our panelists is the notion of plasticity, and especially neuroplasticity. And for me, the paper that convinced me of the plasticity for not necessarily the first time, but a very impressive one, was a Maria Fiataroni paper in 1989, where she took nonagenarians, offered them in a randomized trial exercise versus information, and showed dramatic changes in muscle strength, up to an 800% increase, lean muscle mass, and enough functional recovery that people who were chair-bound became ambulatory. People were able to leave their canes behind, and they didn't need them. Another paper in 2011 by Erickson and a group in Illinois, I believe in PNAS, showed that if you exercise, and again, a trial, young, old-age persons, and follow the size of their hippocampus and other measures, what you can do is show a fairly significant increase in memory abilities and other cognitive functions, which is paralleled by an increase in the size of their hippocampus and by a brain-stimulating growth factor. And you'll hear more about that kind of thing, demonstrating that there really is plasticity in the nervous system. We also have a growing understanding of the interrelationship between medical illness, cognition, and degenerative dementias. These are not separate entities, and I think Laura emphasized the convergence of processes in late life. And finally, I want to emphasize the concept of compression of morbidity. The paper that brought this home to me, and I'm sure to many of you, was the 1980 paper by Jim Fries in the New England Journal, where he asked the question, does the expansion of the lifespan lead to more disability, or is disability going to be postponed? And he termed this the compression of morbidity. We also have heard the phrase active life expectancy, and I think that's what most of our patients and our public wants, is how can I be active and less dependent in the rest of my life? Well, as Laura said, the answer to that question is starting to become clear. There is indeed a compression of morbidity, according to the work of James Vopel in Europe, where he's shown in countries, especially in Northern Europe, that morbidity is being postponed, and people living 90 and older have less morbidity, less functional impairment as they move through their 90s. People essentially die before, relatively speaking, they are likely to become completely dependent. So the idea that Laura mentioned, 70 is the new 60, 80 is the new 70, and 90 may be the new 80, and I see that in my studies. So the last point I'd like to make is that I think Christine will tell you about the compression of cognitive morbidity. The rates of dementia are going down in advanced countries. The absolute numbers of people with dementia, of course, are growing up, but the rates of dementia are going down. And that tells us something about the preventability or modifiability of this. In England, the rates went down enough in one study that the NHS had to revise their estimates of what it was going to cost to care for the next generation of seniors. So in this session, I'd like us to sort of keep our eyes on the prize, which is less on years of life, but more on life to our years. And as we go through the panel, you'll hear about frailty, brain aging, and Alzheimer's disease, neuroplasticity, and the advances that are leading to the compression of morbidity. And I have a prop. I left it in my briefcase, so I want to plug the publication that recently came out on brain aging that Christine and Dan Blazer led. It's a fabulous publication, and you'll learn a lot here today, but you'll also learn a lot more from this book. So with that, I'll turn it over to Linda.